In this video, you will learn how to use Treatment Studio's Restoration View tab. Restoration planning has always been simple, fast, and precise with Treatment Studio, and version 5.3 brings even more robust tools to the process. The software allows clinicians to combine their 3D images with intraoral scans for a more complete representation of the anatomy and greater predictability and accuracy of implant placement and restoration design. After you have virtually placed implants in the Implant tab, select the Restoration icon on the View tab bar. If the Restoration tab does not appear on the Treatment Studio view bar, you have an older version of Treatment Studio. For information about upgrading your Treatment Studio software, contact Imaging Sciences Technical Support. When the Restoration tab opens, you will see that the placed implants have been selected in the Select Restoration window. Next, choose a restoration from the case library similar to the existing teeth. You may choose a restoration based on the patient's gender, dental arch size, and wear of teeth. Once the selections have been made, select OK. The software will now layer the crowns onto the model. This particular case has a digital model from a scanned impression registered to an iCat scan. If you do not have a registered model, you may still use the Restoration tab to get a rough idea of crown sizing and positioning. In the control panel, let's deselect the maxillary model visibility. Next, scroll down towards the bottom of the control panel and deselect teeth visibility. Now let's make positional adjustments to the model to allow for better viewing. Looking at restoration management in the control panel, you will see that all crowns are highlighted. The crowns will also have a dashed red line around them in the rendering window. When all restorations are selected or active, they may be moved together. If, let's say, only one crown is selected, we can include additional ones by holding down the Control keyboard button and left mouse clicking a crown in either Restoration Management or on the rendering window. When the restorations are active, the Restoration widget will be present. This tool allows you to make any positional or dimensional changes to the restorations that may be needed. To change the buccal lingual horizontal tilt, left mouse click on a widget tool, and while holding the left mouse button down, move your mouse. Next, left mouse click on any crown and move the mouse to adjust the buccal lingual position. Change the group sizing by dragging the red or blue bubbles. You may also change the group mesial distal position by mouse clicking on any crown and moving your mouse. Crowns may be moved independently by mouse clicking on one and releasing the button. Then left mouse click and while holding the button down, drag the crown as desired. Next, you may adjust the size of any of the crowns by left mouse clicking on either of the red or blue bubbles of the widget tool and while holding the mouse button down, moving your mouse. As you rotate the model, you will find that the widget tool adjustments are perspective dependent. They will follow your eye. For example, when I move the model from the current axial view to a more coronal view, the same arrow movements we used earlier will allow for a buccal lingual vertical tilt rather than the earlier horizontal tilt changes. When the model is moved to a lateral orientation, the same arrow movement will result in a tilting toward or away from the palate. Let's go ahead and left mouse click on any implant, and while holding the left mouse button down, lower the restorations into position. In the control panel, let's reduce the visibility of the mandibular model so that we can see the implants. Now turn on the teeth visibility. We can now fine-tune the size and position of each restoration relative to the implants by using the widget tools or the restoration editing tools in the control panel. After all the crowns have been selected, left mouse click on a crown to collectively move the restorations to the general area of placement. Next, you may move the widget tool's rotational arrows to change the angulation as necessary. To modify a crown's position, left mouse click, and while holding the left mouse button down, move your mouse. You may use the red and blue bubbles to modify the size of the crowns. To do this, left mouse click on a bubble, and while holding down the mouse button, move the mouse. Continue making adjustments as necessary. In the Restoration Editing section of the Control Panel, we can also make mesial distal or buccal lingual crown adjustments by left mouse clicking on the slide control and moving the mouse. Adjustments may also be made to the crown's height and cusp height dimensions. Now let's increase the visibility of the maxillary model and deselect the teeth visibility. We now have a rough idea how we would want to place the restorations relative to the adjacent crowns and implants. To further fine-tune our restorations, the toolbar contains tools that will be helpful to perfect the position, morphology, and articulation of the adjacent teeth and the opposing jaw. The first tool we'll look at is Show Collision. We'll turn the tool on by clicking on its icon on the toolbar. This tool shows collisions with other restorations. You see that tooth 30 is selected. When looking at it in the upper right view window, we see blue halos on both the mesial and distal surfaces, which indicate collisions with adjacent crowns. To modify the crown so that there are no collisions, we can use the Widgets tools and our mouse to reduce the crown size and to change its positioning. Another method to correct our collision problems is to use the Auto Collision Resolution tool. On the toolbar, mouse click the tool to activate it. Next, move the mouse so that the tool, or a wand, hovers inside the collision indicator's border, and then left mouse click. Let's do the same on the opposing side. The tooth will automatically be shaped to better fit the available space and to avoid any collisions. The next collision tool is the Show Inner Arch Collision. Before I show you this tool, we will need to select Maxillary Model and change to a coronal view. Now let's turn on the Inner Arch Collision tool by clicking on its icon on the toolbar. This tool will show collisions on the stone model. Again, this scan was of impressions that were not in occlusion. Treatment Studio uses a built-in algorithm that does a pretty good job of simulating a closed bite, but is not as accurate as an I/O scan. Now let's turn on the Adjust Occlusion tool by clicking on its icon on the toolbar. Once Adjust Occlusion is activated, left mouse click on the upper stone model and move it down. You can see how the arches are interacting by collisions shown in the two bottom right view windows. Other than the Widgets tools, we have additional tools that may be used to adjust for any inner arch collisions. Let's deactivate the Adjust Occlusion tool by clicking on its icon on the toolbar. Next, deactivate the Show Inner Arch Collision tool. To roll back any changes made by adjusting the occlusion, select Edit on the menu bar and select Undo. Let's take a quick look at the articulation tool by opening it through its icon on the toolbar. This tool allows you to preview how the jaws will move and how the occlusal surfaces will articulate with the opposing arch during jaw movement. Next, let's take a look at the 4 tools for shaping of the crowns. These tools will edit the crown's mesh. A quick definition for mesh would be a collection of vertices, edges, and faces that create a polyhedral object in 3D computer graphics. For our present purpose, the polyhedral object is a crown. Left mouse click on the crown to make it active. Next, click area drag on the toolbar. Then left mouse click on an area of the crown that you would like to change, and while holding the left mouse button down, move the mouse to drag the mesh. The window in the top right hand corner of the viewing window will isolate the active crown for better viewing of any changes to the mesh. You may rotate the crown without any positional changes occurring to the crown. To cancel any changes to the mesh, hold down Control on the keyboard and depress the Z button or select Edit on the menu bar and choose Undo Mesh Area Drag. After you have made any changes with the Area Drag tool, you may advance to the next mesh editing tool by simply right mouse clicking or by clicking on its toolbar icon. The Push Mesh and the Pull Mesh tools enable you to make more subtle changes to the mesh by making small changes with every left mouse click. As before, use Undo and Edit on the menu bar or hold down Control and push Z to undo any unwanted changes. The Smooth tool will allow you to add the finishing touch to a mesh adjustment. Use it as you would fine-grained sandpaper on wood. Another Restoration tab tool is Tooth Extraction. This tool allows you to simulate an immediate extraction case by using a polygonal mesh cutting tool for removing a tooth in the digitized stone model. You can add restorations anytime without a matching implant, which is useful for bridge cases. Let's turn on tooth extraction by clicking on its icon on the toolbar. Left mouse click on the soft tissue around tooth number 23 every quarter inch or so as you circumnavigate the tooth. Right mouse click as you approach the first point that was placed to join the boundary around the tooth. And lastly, left mouse click on the middle of the crown. The software will now remove the tooth. Now let's go ahead and add a restoration. In the Restoration Management section of the control panel, we will select Add New. In the Add Restoration pop-up window, we will choose our tooth from the case library and then choose the tooth number from the Select Restoration window. To place the crown, left mouse click on the mesial side of the extraction site and move the mouse to the distal side and left mouse click. Use the Restoration widget to adjust the crown's size and fit. You may add an implant if you desire or additional restorations without a matching implant, which would be useful for bridge cases. After you have completed your case planning, you may wish to move beyond restoration simulation and have your digital restoration milled by a lab. If so, it is recommended that you begin with a digitized I/O scan rather than a digitized impression. An I/O scan establishes the patient's occlusion during the scan rather than using impression material where occlusion is open rather than closed. To export the digital restorations to an STL file for submission to a lab for further computer design and milling, go to the control panel and mouse click on Export Restorations. In the pop-up window, select the restorations you want to convert to an STL, then select from the available options and mouse click Export. Next, choose where to save to, choose Accept or modify the file name, and then mouse click on Save. The Preference button on the toolbar allows you to customize items such as the collision depth color code and the default color of the restorations, stone models, and grid. You may also adjust how much the mesh editing tools change the mesh per click in the collision visual preferences. Also new with Treatment Studio 5.3 is an automatic simulation of the surgery for enhanced case presentations. Select the Implant tab on the View tabs bar and then select Generate View Sequence located on the menu bar. A pop-up window will appear with parameters that you may adjust. You may include placed implants, abutments, and restorations, turn clipping on or off, change the camera orientation to either an axial or buccal view, or choose the recorded image size. If you would like smoother transitions between sequences, you may choose to adjust the playback speed or the frames per second before playing or saving. If you would like the video to play until you turn it off, you may want to select the loop feature. Make sure that the View Sequence Player slider is all the way to the left, then mouse click play to begin the video. To save your movie so that it may be shared or played at a later time, select Video Capture. Then accept or change the save location. Accept or change the defaulted codec or video decoder, and accept or adjust the video frames or video playing time. You may add an ending logo to your video as well. The image must be either in a JPEG or a bitmap format. I do not have a logo, so I'll use a picture from a recent trip that I took. I'll leave the logo runtime at 4 seconds. Now let's select Capture to save the movie in an AVI movie format. Let's select Yes to play our video. For additional information, consult the Treatment Studio 5.3 Reference Manual or call Imaging Sciences Technical Support at 800-205-3570, option 5. You may also access additional Treatment Studio tutorials by going to our website, icat.com, and choosing Customer Care, then Customer Trainings, and then Online Tips and Tricks webinars. Among the available tutorials are implant planning and placement, tracing the inferior alveolar nerve, custom abutment design, and STL model import and registration to a CBCT volume. From all of us at iCat, thank you for joining us today.